My first question is that there is a tremendous amount of research that shows that greater engagement with one's health leads to better outcomes. In recent years, American innovators have created and improved wearable devices so that not only are consumers able to better engage with their health through monitoring data, but they are able to share that data with providers. I believe American consumers, in line with the 21st Century Cures Act, should be able to access these innovative wellness tools. Secretary Kennedy, do you agree that consumers should continue to have access to these tools?
Absolutely. In fact, we're about to launch one of the biggest advertising campaigns in HHS history to encourage Americans to use wearables. It's a way of people can take control over their own health. They can take responsibility. They can see, as you know, what food is doing to their glucose levels, their heart rates, and a number of other metrics as they eat it. And they can begin to make good judgments about their diet, about their physical activity, about the way that they live their lives. We think that wearables are a key to the MAHA agenda, making America healthy again, and we are going to, my vision is that every American is wearing a wearable within 4 years.
Thank you, Mr. Secretary. Following up on my previous questions, what steps will you take, and you just said that you're going to do a big announcement next week to access digital health tools to track, monitor, and improve their health, while also ensuring appropriate patient data privacy, security, and protections. In dealing with some of that, I have had questions come up when I've spoken to medical groups about wearables and the privacy. Do you have anything reassuring for that, or would that be part of the announcement?
Well, as I said, we're going to do a major advertising campaign encouraging Americans to wear wearables. I've personally had friends who've utterly changed their lives just from wearing a glucose meter. And they've lost weight, they've lost their diabetes, diagnoses, and you see this happen again and again. And it really has a miraculous impact on health in our country. And it's $80 a month, and we're exploring ways of making sure that that those costs can be paid for. The Ozempic is costing $1,300 a month. Right. If you can achieve the same thing with an $80 wearable, it's a lot better for the American people.
Great to hear. My office and I myself are also doing the same thing. I think we share the same belief that digital health tools, including telehealth and remote patient monitoring, are steps in the right direction in ensuring healthcare access. Specifically, I've been a strong advocate for the use and coverage of remote patient monitoring. During your time as Secretary, what progress do you hope to see in terms of access to and improvement of remote patient monitoring tools?
Remote patient monitoring, you mean like AI and AI nurses? Is that what?
Okay.
Yeah, I mean, we are working on that. As I said before, we've brought people into this agency who are the greatest technical expertise probably of any agency, except maybe the Defense Department, the CIA, and the United States government. I'm very encouraged by the caliber of people we've been able to attract to the agency, and that's one of the things we're doing. It's important, it keeps people out of emergency rooms. It's critically important for rural health care and for people who can't travel, for elderly Americans who can't leave their homes, but they can find out what's happening to their health without going to see a doctor or to go to an urgent care or an emergency room.
I agree with that, and I've been working with the federally qualified health centers doing some pilots with that. So, Mr. Chairman, thank you. Secretary Kennedy, Mr. Chairman, I yield back.